specifically in your role as Parliamentary Secretary, I know you're rural health. So I know you've traveled extensively across the province, touring, talking to people, listening. What are some of the cool developments here in rural health that you're excited for as the Parliamentary Secretary?
One of the biggest ones, I was fortunate to attend the announcement for the rural physician training seats. I know that your riding is going to benefit from that immensely, with Northwestern Polytechnic going to house, I believe it's 30 of those students out of 60. The other 30 will be housed in Lethbridge. That isn't simply opening up more training seats. This is a rural stream of training. That they're going to try to fill those seats with kids from rural communities. And that for me is exciting because we all have heard stories of how difficult it is for our rural students to get into the city universities, whether it be for healthcare or other programs. And so I'm really excited that we're going to have a rural stream for our physician program. That's a long-term strategy to get physicians out into the workforce, but we will see the benefit before the end of the about 5-year turnaround, because as residents, they'll actually be out in our communities as well. And so that is a really exciting day for Alberta. Another recent change has been around international medical graduates, where the minister worked extensively with the College of Physicians and Surgeons, and they've come to an agreement of allowing clinics and communities to be able to sponsor international medical graduates, something that previously AHS was primarily responsible for. And so that's something that, again, should benefit a lot of communities that around rural Alberta. I know that there are a number on the list that are already signed up for that program. Inevitably, I'm truly excited about this restructuring overall. We honestly need to have a healthcare system that is patient focused. We have the best frontline healthcare workers anywhere, I would say, on the globe. In Alberta, we are very fortunate, and we have to unleash their ability to do their job. And they didn't get into this profession on a whim. They got into it because they care about people, they care about patients. And as I've gone around on the engagement to hear from frontline folks and hear from community leaders, alongside the Minister of Health, that has been something that has been so evident, is they are so passionate for people, and they just want to see their efforts being appreciated, accepted, and to provide a better care for patients. And so I'm really excited overall. I think that it's not going to be an overnight fix, but over these next couple of years, to see the system improvements and to continue to receive feedback from frontline workers and from communities, and basically tailor a healthcare system that meets the needs of our communities.
Excellent. Well, I'm really excited for those things here, Martin. Our government's done a huge amount of work, heavy lifting, and so thanks for helping out with that. It really does mean, I think, a lot to not just rural, but also to everybody right across the province. So thanks for your work on that.